Hi, I'm Sherry Harlan, program host for Reid Beside You, and welcome to today's show. Our guests today are representatives from the American Cancer Society. We have Mary Beth Torcell,
Yep.
and she is the program manager, and Paul Moore, who is the health systems manager for the American Cancer Society. And welcome to Reid Beside You.
Thank you.
Thanks for having us.
And first, before we get started, tell me a little about your background with the American Cancer Society. You want to start, Mary Beth?
Sure. So I have been with the American Cancer Society for 11 years. I've done pretty much the same thing the whole time. My main role is to recruit volunteers. We're a volunteer-based organization, so we heavily rely on volunteers who then provide the services for our patients that need help.
Great. And Paul?
And I've been with the American Cancer Society now for 3 years. My primary role is working with different hospitals and working with and designing programs for early detection, screening, prevention type programs to help the community out. And then we get those out to the community, and our end goal is to end cancer.
And just give us an idea of your overall background and some things that you do in the Wayne County area.
So I have actually I just kind of inherited this area about last year. So I'm jumping in and getting my feet wet. So we've been really working the past couple months heavily to get this program started, this road recovery program.
And I'm a Wayne County native. So, I've been here since 1984. Lived in Wayne County pretty much my whole life. And so I was fortunate enough to cross paths with Mary Beth as, we noticed that there's a need for our road to recovery drivers, which we'll go into more detail. But so our paths crossed about a year ago. And so we've been working in partnership with several different health systems, but specifically we're really excited about the opportunity in Wayne County with Reid.
Well, great. One of the first things that people hear, you have the privilege, as well as sometimes not so much of a privilege, when people hear cancer, often people just shut off.
Mm-hmm.
Right. But normally when you first hear about American Cancer Society, you just think of the disease and not, there's so many other things that it entails.
Right. And you're right. People, as soon as they hear the word cancer, they kind of stop listening. But and that's where we come in, because not only do we do programs and services, each of us that work for the organization have different roles. Mm-hmm. My role is to get volunteers, his role is to work with health systems, but we also have one of my favorite features is our 1-800 number, where people can call in and they can talk to a live cancer specialist. So, when you hear you have cancer, you kind of stop listening to the doctor. Then you go home and at 3 a.m. you wake up like, what happened? What did he talk about?
I have an idea.
Yeah, like, what should I do? You can actually call and speak to a real person. And they're there at 3 a.m. to talk to you and to help you and to kind of talk through your diagnosis and what you need to do. It's amazing.
Now, some of when you get those phone calls or when you're calling are they medical professionals? Are they cancer survivors? Or
it depends. Sometimes we have college students that call in and say, I'm doing a report. Can you help me? Give me some information. Sometimes we have the patient themselves calls. Sometimes the medical professionals will call in. Other times you'll get a caregiver that calls and says, my wife has cancer and I just don't know what to do. Or even like my mom was diagnosed with cancer in April, and I called and said, here I am. I work for the American Cancer Society, and instantly my brain went to worst case scenario, and I'm like, my mom's going to die. So I called at 2:30 in the morning, and just said, I don't know what to do. And they walk you through it. They're trained in all of that, and they walk you through your call.
And we find that a lot of people, especially caregivers, will be those 2 a.m., 3 a.m. calls because they finally had a chance to take care of their loved one, get their affairs in order, and then all of a sudden that thought in the back of their head says, oh, I wish I would have asked this question. And again, that's what's nice about that toll-free line is it is manned 24 hours a day, 365 days a year. So, Christmas morning you can call, Thanksgiving Day you can call. There's always someone there that will talk to you.
That's amazing. Mm-hmm. But I was very interested, because the first thing I thought when we said we're going to meet with the American Cancer Society and talk with you, first thing I was thinking of more of the disease.
Mm-hmm.
But realizing that a very clear need is your new road to recovery. So
Yes.
let's talk about the
Okay.
the recovery program.
Yeah, this program is, it's amazing. It has been around, it started back in the 80s in Boston. That's actually where it originated, where it was kind of interesting. We just had volunteers sitting around and they noticed the need and they started it themselves. And then the organization adopted it and, put all of our resources behind it. So we made it the program official, and I think it was 82. In Indiana, it's here, but it's not everywhere. I think Indianapolis has a pretty strong road recovery program, and Fort Wayne does.
A lot of the metro areas are,
And
are
that's
pretty well covered.
very clear need. So let's so exactly tell me, what is road to recovery? Tell our viewers exactly what happens.
Road to recovery,
with road recovery.
We utilize volunteers who use their car and they will go pick up a patient who needs to get to treatment, and they take them to their cancer treatment. And sometimes they wait for them. If it's a long treatment, they might wait in the hospital in the waiting room, or they can leave and come back, and then they take them back home. So they're basically taking them to their appointment and then back home again.
Okay, and that seems that would be really needed in our area.
It is.
Because we are actually a rural health
Correct.
area.
Yep, and that's what I find is we have the big cities have cabs and Ubers, and we don't have that in some of the rural areas. So we really do rely on the volunteers, and we need it definitely. There's an outlying area that we definitely need to get the program started.
And when those people, and I just want to also reiterate, with the changes in demographics, and there are people, not a lot yet, used to be, your entire family was within 5 miles of you.
Yep.
And as people have moved in different parts of the country, so that there's people that are just by themselves.
Yeah.
So that's why you need that road to recovery, or having someone that can take someone to get to their appointment.
Definitely, because what we find a lot too is even if they do have a support system, which oftentimes they don't, but if they did, chemo or radiation can be every day for 8 weeks. That's very tiring and taxing, even if you do have friends to help.
Right.
So sometimes they do, and then the road to recovery can just kind of fill in the gaps when somebody says, I actually talked to a patient not too long ago who said that their spouse was going to lose their job if they took off one more day to take them to treatment. And they just, that's, unfortunately, we hear that a lot.
And we sometimes, even with the support group they have, they don't want to call because they don't want to burden their friends. They don't want to burden their sons and daughters. They have very busy schedules with their kids, taking them to and from practices.
So in essence, this road to recovery is actually saving lives because it gets people the access that they need.
It definitely is. I mean, you think about, even if that's their cure, their treatment is saving their life. So the best treatment, and we've advanced so much over the years in medical, breakthroughs and treatments. And if you can't get there, that's going to do you no good.
Right. Especially with the research funding that we provide, helps put all this into work and this action with these new meds and new types of treatment. Again, it goes for nothing if you're unable to get there.
Right. So it'd be shameful that with all the research and the advances in technology, to have someone say, "Well, I can only make it to one treatment out of 4 or 5 days."
Yep.
Yeah.
And that happens.
And that happens a lot.
Yep.
And it seems to be. And give me an example of maybe some ideas that the community could think about on bringing it to more of the rural area.
If anybody's interested in driving, they can call me and I will get them. There's a training that they need to do.
Tell us about the training.
Okay, so you definitely have, we want to make sure that the people that are driving our cancer patients have a clean, criminal record, a motor vehicle record, and they have to be between 18 and 85. So there's a pretty big range there in age. And they do have to have, a valid driver's license for Indiana and a good working car. So those are the general requirements. And then the training, there's 2 ways to get trained. One is online, which is actually really cool if you like to, sit in front of your computer in your pajamas, you can do the training.
Right.
But I'm trying to pull together some people to do it in person because some people, it's more it's easier when you have a group of people there. I feel like it's easier to go through the training that way. So there's those two options. If you did it online at home from start to finish, it would be 2 hours, but you could break it up. You don't have to do it all in one sitting. And it'd be about the same length of time if you get together with me. The training, we go over a lot. We do a lot of privacy and confidential HIPAA laws. You have to be really careful with certain things. So we go over a lot of that. And then just some general, just safety stuff. And then that's really it. And then they utilize we have our own web-based program called Service Match that we utilize to match up patients to drivers. And they get trained in that because it's not hard at all. Actually, if you can get on Facebook, you can get on this website. It's very simple.
So that gives me an idea that, and I know that you're always available to go out to different groups. So if there was an organization that needed, they might want a new project.
Yes.
Right.
Or another way that they could give back to the community, this would be an ideal opportunity. And I'm sure you would have no problem coming if we get a group together to do that training, just in case they didn't want to do it. There's still hesitance for some people to just sit online. I mean, get online by themselves, and they might be more of a group learning environment. And I'm sure that you would adjust to that.
Definitely. I love doing in-person trainings. I love to meet the volunteers. I just love doing that. It's my favorite part of my job. So I will definitely do that. And I'll go speak to any organization, if somebody wants me to come in and just explain the program, I can do that. Churches, if they're ever looking for like a social, something that they want to do.
Civic groups.
Right.
Yeah, any students that need volunteer hours, if they're over 18 and they want to drive, I will come talk to anybody anytime about this program.
And I think what's nice about this program, Road to Recovery, too, is I think when some people think, okay, I'm going to sign up to be a driver, that, oh my goodness, I don't have enough time to do it. This isn't something that you have to do every day. It's not something you have to do every week. It's pretty flexible where you look at it and say, my schedule allows me to do 3 rides this week or maybe 2 rides this week. You go on to Service Match, you're able to see time frames when things are open and available, select them or not select them, your choice. So it's not something that when you sign up, you have to say, Mary Beth, I'm promising 30 hours a week or 15 hours a week. It's at your leisure.
And that's great. The flexibility. So, or if maybe your schedule, you thought you were busy all month, and then
you freeze up.
It frees up, so you could go on the Service Master, and that's also part of the online training, the website.
Yes, you would be trained in how to use Service Match at that time too. It's in one of the trainings. I had a thought and I just lost it.
No
but
problem.
yeah, it's basically it's very along the lines of being flexible. We have some drivers who maybe drive once a week, maybe drive once a month. I just was told that one of my drivers is leaving to go to Florida until March. I'm so jealous, but that happens. So it's very flexible. It's based on when the driver is available.
That's great. And so back on with the scheduling. Give me an example of a success story.
Oh my gosh, I have so many success stories.
Yes.
We'll take them.
We have patients all the time who, can't get to the treatment, so they call. And a lot of times, sometimes it works out that if it's a radiation appointment and they're going 5 days a week for however many weeks, sometimes it works out that the same. In one of my areas, we had a driver who took every Monday for the 5 weeks. We had one that took every Tuesday, and then we had one that did the Wednesday, Thursday, Friday for that whole time period. And they get to be very good friends with these patients.
Yes.
Sometimes, I actually know somebody who's been driving for 11 years, and they're still friends with their patient that they drove. So it's a feel-good, opportunity too, because gosh, how many times have I told you, oh, thanks, you're a lifesaver?
A lot.
When you're driving somebody to their treatment, you really are.
You really are a lifesaver.
And it's kind of hard to wrap your head around that. So I think I just said that yesterday. It's really hard to wrap your head around the fact that you're saving their life. And it's just, maybe it's on your way to, to somewhere and you're just going to drop them off and then go do something. It's simple.
People plan their schedule and they're saying, you know what, I need to go shopping for groceries. And that usually takes me about an hour. And I know if I look on my match today, I know that this appointment's going to take about an hour. So I'm going to Richmond anyways. I can pick up somebody, help them get their treatment, help them get to their doctor's appointment, a follow-up visit, go get my groceries, come back, pick them up, drop them off, and it's so flexible, and it does provide that intrinsic value of that, I'm really helping someone today who otherwise
As
would
well
have
as
not
you're
been able
helping
to get anything.
not only that particular patient, the entire family.
That's true.
So
That's true.
often, I had a loved one that had cancer, and trying to go to work, making sure that they got to their appointments,
Yeah.
and thank goodness for friends and neighbors
I know.
at the time.
Yep.
Because I couldn't be off like that every
Yeah.
day. So it was great to have that assistance, and also it gives them another person to speak with.
Yes, because sometimes, especially if you're alone, especially if you don't have anybody,
Right.
that driver not only is taking you physically to save your life, but mentally and spiritually too, because you have somebody to speak with. It's huge. It's a big.
Right.
It is a life changer
Right.
for the driver and for the patient
Right,
too.
so I could give them a listening ear.
Yeah,
So they probably needed that.
Yep, I've actually driven a couple times, and I'll tell you what, for something so small as just dropping somebody off at their treatment, it's the best feeling. It's amazing. It's just awesome.
Did you have a story?
I just think, I have not actually known anyone who has utilized it since I'm not
You're not
dealing
out
a
in
lot
the-
out in
right.
the field with that. But I do know that when you get those success stories, we have heard of people saying that the friendships that develop and the bonds they form are really, really strong, especially, when that final treatment is over, that the friendship continues, and instead of going to treatments now, they're going to lunch, or they're
That's
going
even
to a
better.
movie, or they're playing
Going to
cards
coffee,
together.
yep.
So, those relationships that you build, the people who typically do the drives, the people who are doing the drivers are servant hearts. They have that value inside them that says, I want to help. And so, when they get that opportunity, it blossoms, and then they're able to tell a friend, and that friend's able to tell a friend, and that's how we build our programs. Is
Yeah.
that they have those good experiences and they share them in the community, and then someone says, you know what, that's a pretty good idea.
I want to do that.
I'm going
Yep.
to do that. You mean I can, just maybe do 2 rides a week
Yeah.
or 1 ride a week? I can do that. And then it goes from 1 to 5 to 10. So it's just getting that crucial nucleus built that we're starting to do today, and that's why we're here.
Oh, that's exciting. And on another note, Paul, I know that you work so closely with various health systems in the area. What are some of the other programs that the American Cancer Society?
Well, for us on the health system sides, we work with a lot of the cancer committees, and we help design programs that benefit specifically Wayne County or other counties that I work in with screening and preventions, early detections. The best way to stop cancer is to catch it early or to prevent it.
And when
in
you're
its
saying
entirety.
cancer committees, are they the cancer committees at hospitals?
Cancer
or-
committees at hospitals. So
Okay.
it's a
Give us an example.
A network of our physicians here, like Dr. Grayson, Dr. Camus. They also have nursing staff there. They have case management there. So it's the whole continuum of care from when that person has that initial diagnosis to when they're through with their treatments. Those are the people there that are in this committee. And again, they talk about what needs are in our community. We know what our high cancer rates are. We know what our indices are. But based upon that, then they start saying, what programs can we offer to help that? They're looking at the underinsured, underserved type of population as well. So we need to get out. Big ones right now, we want to talk about colorectal screens. It's one of the easiest cancers to start that and say, this is preventative because we were able to catch it. We were able to detect it. Talk about HPV vaccinations, back to school shots. We need to get that included to the shot records. And so as we go through this, we look at what's available and what the needs are in the community, and then we provide those prevention
How do
and
you get
screening
your
programs.
messaging to those affected communities?
We typically will do, Reid is really good about using the Palladium item. They're good about using their web-based program,
Our
you know,
social
going
media.
on your social media, Facebook, Twitter. But they also have community benefit people that go out and will talk to different organizations like churches and, again, civic groups that go out and say, hey, in this area, you know, this is what this is our area that we're really focusing on. So that's where you go and deliver the message to.
So in that same case, then we'll have information how those groups could actually contact you as well.
How they can contact us and get the information on the screens and the educational services that will be provided as well.
And I want to make sure that people understand that when you're saying with you're working in the committee, you are right there.
I'm sitting with all
sitting with
these
the physicians
cancer
and
professionals and
people from oncology.
people from radiation, people, again, from case management, nursing. I mean, everyone who touches that patient is in that room.
So you're right there.
And
often I'm sure some people will recognize you from
Yeah, every once in a while, I have some really good relationships that I've formed, and so I'm very, very blessed to be here.
Great. The another program, Reach to Recovery.
Right. So, and you just asked me about that yesterday.
We did. We had a question on that. So it's a great program.
It is. So Reach to Recovery actually is one of the programs that have been around the longest because it started way back when breast cancer, you just didn't talk about it. It was cancer itself, you didn't talk about
Very
it. It
taboo.
was very taboo. So, these women were going through mastectomies and going through, these breast surgeries, and they had no one to talk to because
They're
anyone
lost.
that had it,
Right.
they didn't talk about it. So this program was started a long time ago, and it was a woman who said, you know what, I've had breast cancer, I'm not afraid to talk about it, this is ridiculous. And she actually started going into hospitals after women, that's when they kept you in the hospital after a mastectomy. Now it's same day and you're out, but back then, they used to keep you in there, and she would go in and talk to these women. So then it evolved into, if a woman has been diagnosed with breast cancer and she chooses to talk to somebody, we can match her up with somebody who has had the same type of breast cancer, the same type of treatment, at the same age that she was when, and we match them up. And it's just a way to say, you know what, I've been there, I survived it, you can do this too, and just to provide hope.
I felt that way. It's okay to feel this way. This is what you might experience.
Your own personal cheerleader.
Yes,
Yes.
exactly. And it makes a big difference. Nowadays, everybody knows somebody that's had cancer. So it's really not hard to talk to anybody anymore. We have, we have a survivor website where people can go, a chat group and stuff. So there's, now it's a whole different.
You see various blogs.
Yes. Oh, yes, definitely. But the program's still around and people still use it, and it's a great program.
Great. And some other programs that you have?
Right now, we still offer, we have vouchers for people to get free wigs, up to $70 towards a free wig. We also have wig salons where women can go in who have lost their hair because of treatment, can go in and get a brand new wig. We also have, a medical assistance program, an insurance assistance program,
Insurance assistance,
where
yes.
if they call our 1-800 number, they can get hooked up with that. We have free lodging. So, we're blessed here to have good treatment options, but sometimes treatment takes you away from home, and you might need a place to stay. So we have hotel partnerships where they can get a free hotel room. In Cleveland, we have a Hope Lodge, and they can stay there. It's kind of like a Ronald McDonald House, but it's where caregivers and patients can stay for free while they get treatment. So we have those options. We have, what am I missing?
That's you're covered the great amount.
The
I mean,
basics.
that's the ones that are primarily used. There's so much more that you can call, and again, the best part about it is that with the number you call in on, that you'll be able to talk to somebody, and someone will be able to get you an answer, guide you to an answer, or help you.
Exactly.
So you're not just going to.
So in
not
case,
have
and so
anything.
the contact information that we will show, you just call that number,
Right. Yep.
and express exactly what your concern is or your interest.
Yes, and if we, I remember one of my teachers one time said, it's not so important that you have the answer, but you know where to find the
You know
answer.
where to find it.
Correct.
So we
Exactly.
have a database of over 60,000 community resources. So if somebody calls in and they say, I live in Richmond, Indiana, here's what I need help with. If we can't do that, like if we can't pay your electric bill for the month, we can help you locate a resource that can help you.
Right.
So very, mean, I don't think, very rarely do we say, sorry, we have absolutely no way to help you. If we can't help them, we try to hook them up with somebody that can.
Yes.
So one of my jobs, one of my roles is to scout for community resources. So if there's a service that's provided, I make sure it gets into our database so that people can be hooked
So
up with
locally here, we use a lot of 211. So
Yep.
if someone had a question, they could call 211
Yes.
and be
Yep.
directed to
Yep,
your
to us.
organization.
Yeah.
And that's one of the ones that we have in our database
Yep.
that says if someone said they needed help building a ramp. I recently have been confined to a wheelchair during my treatment. I need to build a ramp. Not something the American Cancer Society pays for, but in our database we go, hey, we know that 211 in Wayne County would have some information on who you need to contact to help you.
Correct.
So again, it's that whole part of servicing the needs.
Is there another big push aside from the Road to Recovery that we can look forward to in 2019? From the American Cancer
I would say
Society?
once we get our drivers, because right now we have no drivers. So if somebody calls in for help with getting a ride to treatment, unfortunately we can't help yet. But once we get drivers, I would love to be able to come back and say, hey, if you have cancer and you need help getting to your treatments, please call us. That'll be my next big push.
I think from my standpoint is I work a lot with another community partner who does the Relay for Lives. So if you're a social media person, there have been posts already out there. Reid has been a fantastic sponsor my 3 years in tenure and beyond that with the Relay for Life here. So if you're interested in volunteering, you can call that 1-800 number again, or you can call me as well, and I can get you in contact with the person who needs to do that. It's a great way. We celebrate the people who are winning the battle. We celebrate the people who won the battle, and we also have a special time where we honor those who have lost their battle to cancer as well. It's a great day. Lots of people come, and so that's my big thing I'm looking forward to.
Well, great. Well, we want to thank both Mary Beth and Paul for being here and joining us today on Reid Beside You.
Thanks for having us.
Thank you, and thank you.